about 50% of what I used to be. Where I might have taken 2 weeks to prune the 90 roses, it took me about a month and a bit to get through them.
The final voyage of the Ruby Princess last March was also Bruce and Di McCallum's final cruise. Both of them were struck down with COVID-19. Bruce spent weeks in the Royal Adelaide Hospital and is still suffering from the disease. Diane and Bruce were among more than 2,000 passengers all allowed to disembark at Sydney's Circular Quay. Nearly 700 passengers and crew later tested positive to COVID-19 and 28 passengers died. Tonight, 7:30 reveals a report highlighting failures by one of the key federal government agencies tasked with preventing human diseases from breaching Australia's borders, the Agriculture Department.
There's a whole sequence of events that have led to the department and its frontline officers not being as ready as the nation needed them to be.
It's the Commonwealth Agriculture Department's job to check that arriving ships aren't bringing in plant or animal diseases or major human health diseases. And ultimately, it's these federal officials that give clearance for people to disembark. The report from the independent Commonwealth watchdog, the Inspector General of Biosecurity, examines the Agriculture Department's role, and the findings are damning.
I think my report is pretty clear that I thought the department was poorly prepared.
New South Wales health officials had deemed the Ruby Princess low risk the day before it arrived in Sydney Harbour, but that decision was based on health information that had become out of date. There was a chance for this to be spotted during the Agriculture Department's ship inspection, but the report shows inspection protocols were not followed that would have seen interviews with sick travellers and the ship's master and an examination of the vessel's medical logs. If the acute respiratory diseases log had been viewed on the morning of 19 March, it would have been noted that the log had not been updated since 17 March. This should have prompted contact with the Human Biosecurity Officer. That is, an expert from New South Wales Health.
I found it astounding that they didn't really take more care. So a lot of things were left off that should have been done.
The report shows the officer sent aboard that morning was not senior and experienced. Notes from the inspection only mention a handful of gastro cases. There's nothing about any respiratory illness. And there's no record the officer who boarded was trained to perform the inspection.
It's a great pity that the system did not quite formally positively prevent relatively junior Commonwealth officers bearing the awful responsibility of deciding whether or not the public health risk was too great to allow what I'll call ordinary or routine disembarkation.
Yeah, we do have after effects. Headache, runny nose. I still get throats from it. Terrible.
Mary Behrens is one of those suffering the after effects of COVID-19 and the many Ruby Princess failings.
We went on a holiday, our first trip on a cruise ship. We went thinking we'd come home really nice and well after having a holiday, and we come home sick. So no, nobody did their job. Nobody.
To make matters worse, the report reveals there was an audit into biosecurity for arriving ships in 2018, but much of it wasn't acted upon.
Frankly, if the department had done what it agreed to do, then the chances of a Ruby Princess incident happening were significantly reduced.
Overall, the Inspector General finds that several issues highlighted in his report on the federal agency's performance are likely to have contributed to the Ruby Princess incident.
It's not often that you see an Inspector General's report expressed so many and so clear a set of adverse criticisms of governmental conduct.
Barrister Brett Walker ran last year's New South Wales Special Commission of Inquiry into the disaster. He says mistakes by state officials remained the most important factor in the debacle, but he's told 730 there's a real chance those mistakes could have been prevented if the Commonwealth had done a better job.
If the Commonwealth system had been better, or if the good parts of its system had been adhered to properly, then it is quite likely, I can't say more likely than not, it's quite likely that there would not have been the really dangerous slip-up that did occur, leading to death.
The Federal Agriculture Minister, David Littleproud, insists his department isn't ultimately to blame.
The Department of Agriculture can definitely do better, and I'm expecting them to do better. But in essence, the Ruby Princess was a failing of New South Wales Health.
More than a year on from Brett Walker's landmark report, 730 can reveal some of his recommendations are yet to be implemented, including changes to the Federal Biosecurity Act.
It doesn't take very long to draft amendments if amendments are thought appropriate. More than a year is, to put it very mildly, more than enough.
Drafting legislation does take time, and then it also takes consultation. So we've gone through that process, and the legislation will be put into Parliament very soon.
Those whose lives have been changed by the debacle say all the reports must lead to reforms.
We don't ever want that to happen again. So yes, it's very important they do try to stop anything that's going to harm anybody and the country.
Let's hope that all those recommendations are implemented and the jobs are done properly. Certainly hope that this never happens again.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.